might be working clinically and dipping in. So welcome everybody. My name's Emma Wallace. For those of you that don't know me, I'm one of the interim deputy directors of nursing and quality. So it's my pleasure, very pleased and proud to facilitate the final celebration session and webinar of our International Nurses Day, which have been held across the week. And I've been to all but one because I was off on Wednesday, and I think it's just been a fantastic celebration of international nurses, nursing specialisms through LPT, and the passion and the enthusiasms really come through. So thank you for joining us today. So I think the theme for this day is celebrating nursing past, present and future. Thanks, Anita. So Anita's going to be our next slide, please. If you want to take control of the slides when you're presenting, then that's absolutely fine. We can sort that, can't we, Anita? Just for session etiquette, if you can keep your microphone on mute so everybody can hear the speakers clearly. Do use the hands option or the chat box if you want to make a comment. There will be time, I think, at the end of the session for any immediate questions, but we have factored in at the end a little bit of time for the Ask the Panel, so we can always hold on to those questions as well at the end. If the connection's not great, and I experienced this on Tuesday, turn your camera off, and then you might be able to hear, because sometimes you get that feedback. So thank you. So without further ado, I'd like to welcome Alison Kirk and Emily Robertshaw, who are going to do our first session, which is anyway, over to you, Alison and Emily.
Thanks, Emma. Hi everybody, good afternoon, and well, congratulations. I'm personally experiencing the gift of beautiful nursing with my mother-in-law, who broke her hip last night. So she's after a 9-hour wait in an ambulance, she's now just undergoing surgery at UHL, but absolutely surrounded by people, she's saying, that are looking after her incredibly well. So having that first-hand experience today. But yeah, thank you. I'm head of patient experience and involvement across the trust, so sit within the nursing directorate. As a non-clinical person, I feel quite privileged to be working with them within the nursing directorate. But and we cover lots of areas, from complaints, concerns, all the way through to friends and family tests, patient experience, and involving people with lived experience in our services. So that's me, and I'll just quickly hand over to Emily.
Lovely. Hi everyone, and thanks for the invite to this today. I mean, Alison will be mainly leading this session, so I'm just here really to say hello. But as most of you know, I'm new into role as Deputy Head of Patient Experience and Involvement, having moved across from working in FYPCLD for over 12 years. Alike to Alison, I've had the privilege of working with many wonderful nurses over the last 12 years. And I often look back to one of my first roles in the trust, where I worked alongside health visitors, supporting families with their lifestyle changes. And that's something that, and that experience of working with that group of professionals, I've learnt so much over the years and never forget that time and that role. So thank you for letting me share that, and over to you, Alison.
Okay, thanks. Anita, just quickly check, we've got a video at the end. Are you enabled audio and everything, so that will play, or do you need me to do anything?
It should work. If it doesn't work, we will fix it, don't worry.
No worries. Can I just take control then, just because some of the slides I'll go through quite quickly, if that's okay? If I just click on take control, is that okay?
Yep.
Thank you. Right, everybody, so yeah, over we go then. So can you, has that slide moved forward? Because it's just disappeared now from me. Can you see that slide?
We can see it, Alison. Can you?
No, I can't. So it is going to be quite tricky. I'm going to hand back control. I'm really sorry. Back to you. If you just move them forward for me, Anita, that'd be really helpful, because it's not working. I can't see the slides at all.
You can do your next slide. You know, Professor Whitty, next slide, Alison.
Yeah, if only. Okay.
Just give me one moment then to get it back on.
Oh, I'm sorry. Have I for everybody? I bet you've had a whole week of this, haven't you? People coming on thinking they can take control and then completely lose control.
Yeah, it's fine. Everybody's let me take control, and then it's like, oh, we'll try. No, I won't try.
Welcome, Sarah. We're just perfect timing. We're just about to start.
Emma, you can sing.
Oh, I've got the worst singing voice ever.
I'm just going to put my camera off for a minute while I munch my sandwich, if you don't
Okay.
mind, but I am listening. Thank you. Did it go well yesterday?
It was fantastic.
Was
Yeah,
it? I've heard her speak before. It is really interesting.
it's really good. And hearing Anne's story as well.
Yeah.
Lovely.
Okay, so we're ready. Thank you, Anita. Okay, so yeah, so our session really we're going to look at how have nurses positively impacted or are improving patient experience through working with patients and carers, and this is absolutely through our LPT lens. So next slide, please, Anita. So just to recap, I'm not going to dwell on this. We all know Step Up to Great very well, but I think it is really important to pull out that actually patient experience and involvement is one of the priorities within Step Up to Great, and it's so good to see that there. Although I think it runs through everything that we do, making sure that we have that focus on delivering really good care and more importantly, really positive experience and outcome for patients is so important. So for us, in terms of that brick, our priority area is we have 3 areas that we're looking at. They are about making it easy and straightforward for people to share their experiences. It's about how we increase the number of people who are positively participating in their care and in service improvement, and how we improve the experience of people who use or are impacted by our service, and really about how we learn from complaints and when things go wrong, but actually also when we celebrate when things go really, really well. So next slide, please. I had a quick look and I just thought, where is this stated? And I know that this is this is the DNA of I suppose of all health and care professionals in the NHS, but I looked through and I saw the code in terms of the things that actually from the Nursing and Midwifery Council, the things that certainly nurses are asked to focus on. And it was really interesting. I was asked to go and speak to a group of third-year students, mental health nurse students, the other day at DMU, and we talked about complaints and concerns and their role within that. And it was really, really interesting to see actually the views of new people that haven't come into the system in terms of how they perceive this. But for me, you know, the key element of this is absolutely aligned in our strategy is about treating people as individuals and upholding dignity, listening to and responding to people's preferences and their concerns, making sure that people's physical, social and psychological needs are met, and acting in the best interests of people at all times. And, you know, obviously then about having the right to privacy and dignity. So I think for me, you know, it goes without saying that we see this every day. We certainly see this through the information I'm going to take you through in the next few slides. But I just really wanted to go back on what we think matters to patients. So next slide, please, Anita. So really, what does a good experience look like? And this is a really good picture here. I love this picture. We've used it many times, but as Kermit the Frog sat there and the sort of guy saying to him, you know, what I'm about to tell you might come as a big shock. But I think for me, you know, it's not just about the clinical delivery of care, is it? It's about how we talk, how we interact, and actually how we are personable with people. And I think for me, certainly through compliments, concerns, complaints, over and above, we do always see that actually people are really majority really happy with the outcome and the care that's delivered to them. But actually sometimes it's the processes and the systems that actually let people down, and we're just going to focus that on in a small bit. So next slide, please, Anita. So we did some research many years ago when I worked with the NHS Institute, but actually that hasn't changed. And this was done in 2010, but actually I think we still know the same things. For our patients and for our carers and for our public, good care is about getting the basics right. Next slide, please. And that is about getting it right and don't leave things to chance, making sure that we are expecting services to fit in with the lives of patients and carers and actually not forcing them to fit into ours. Treating me as a person and not a symptom, and working with a partner in my health, not just as a recipient of care. And I think all of those absolutely align back to the things we just looked at in the code. I think they're all still the key things in terms of what delivers a really positive experience of care. Next slide, please. So it begins with what matters to patients. For me, it's around identifying key service areas through recognition events or touch points. You know, we talk about people having journeys of care through health systems, and actually sometimes it's at those touch points when things go wrong or what makes a difference to an experience. It's about measuring it, benchmarking it and building on it. And that absolutely links to our priority around understanding what matters, what our patient information and our feedback tells us, and more importantly, what we do with it and how we build on it. But it's also about recognising and celebrating. You know, we have an overwhelming majority of feedback which is positive into this trust. It far outweighs the negative feedback that we get back. But we don't tend to focus on that. I think we always tend to focus on the negative, and there's something about how we recognise good practice, how we spread it and how we share it. So in terms of the research, what told us that there were two important dimensions to what matters to patients. It's about what happens to them, and importantly, how they feel about what has happened to them or how they feel about that experience. So next slide, please. So they equate experience to being two things. It's about the rational, which is about the head, and the rational things we talk about, I feel like our systems and processes. So waiting for an appointment, arriving and being delayed, or it could be about, you know, patient information. It's all about the processes that we put in place. But then you have the relational or the emotional aspects of care, and that is about how people are treated, how people are behaved, and the attitudes that people bring into their roles. Next slide, please. You combine with the emotional and the rational, and then you add in some magic. So, you know, one of the magics of the recent times has been hello, my name is. It's a very simple thing to do, but actually a magic moment is, you know, just introducing yourself. A moment of magic, which I've certainly seen out in our community wards, is what matters to me. You know, those little signs that sit behind a bed, and actually what matters to me is my cat called Tom, or my husband called Derek, or my children called, you know, whatever. Those little moments of magic, you put those together with the basics, absolutely then create the right patient experience. So next slide, please. And magic, you know, always are about great memories and great stories. And we're very good, aren't we, around narrative and collecting stories of really good care. You know, that nurse was really amazing because, you know, she gave me time. She called me by my first name. But also then about getting those basics right, and they are the expected standards. You know, when we walk into our environments or when we receive care, it's about getting that basics right. Was it clean? Was I treated with dignity and respect, etc., etc.? So what matters to patients is absolutely about how you pull all of them together into one experience. So next slide, please. Making up of head and heart, magic and basics, and you bring all of those together. You know, and that absolutely creates the right environment for positive experience. And I want to now just talk about how that is being delivered within our trust and what we're hearing from our patients and carers. So next slide, please. Sorry, next one. So we capture our experiences, I'm sure you know, around the 4 C's. We call them comments, concerns, complaints and compliments. So you know that we collect them through a series of ways. We've got our PALs, we've got our complaints, we've got staff working on a one-to-one basis, we've got services, we've got feedback coming in through external organisations. So all of that comes into our melting pot of a really strong base of evidence that tells us what our patients and carers want and expect and actually receive when they're in our care. Next slide, please. And what they tell us, what we're doing, actually, they tell us that we're getting the head, the heart absolutely right, because actually we are overwhelmingly receiving positive experiences of care. So the figures on, they may be on your left, they're on my right, but if they're on your right, We have got over sort of 82% of all of the feedback that we had last year, and that is 22,500 individual pieces of feedback, told us that we were delivering really high quality and positive experiences of care. We had 10% of people saying that that was negative. When you start to look at that information, the negative elements of that care come down to processes and systems. It's because people didn't get the appointment because of a clinic being cancelled, they didn't get the referral, or we didn't meet their expectation in terms of maybe the prescription that they received or the diagnosis. But absolutely positively, and that's reflected in some of the words I'm hoping you can see below there, you know, staff attitude. I can't really see them on the screen now, but you know, all of that element is around the positivity. And our top three themes that came through in terms of positive experience was around access to services, discharge processes and appointments. They were what people say really, really challenged them. And actually that was about the process and the system, but actually the things that really were positive were about the environments in which people were cared for, the attitude of staff and how they provided that care, and how that care was absolutely implemented. And I think something we also really, really need to know is that 41% of everything we receive back through complaints, concerns, comments and compliments is positive. So I think that, you know, that is really positive because, as I say, I certainly don't write many reports that celebrate the positivity of experience. I tend to write reports that focus on the negative. And today this is about reflecting on actually you are all of you doing amazing interactions and relationships and delivery of care with our patients. And the figures, they don't lie, and the comments, they don't lie. So next slide, please. These are just some of the words, and I've just pulled some out. We get hundreds and hundreds of these, and I just wanted to just hold for a couple of minutes to just give people time just to really read and just take in just some of the comments and the impact of what positive care has meant, not just to patients, but to their families. I just think, you know, they make me very proud, and I'm not a nurse, but they make me very, very proud to read those. And as I say, they are just literally a handful of the impact that you, your teams, your colleagues do have with people on a day-to-day. And yeah, thank you. Lots of smiles to the screen. That's really good, Emma. And I think this is about actually how we celebrate that. Next slide, please. But it's not just about the delivery, is it? Now we've got lots of nurse-led quality improvement projects which are taking place across the organisation, and certainly some that I know that my team have been involved with around how we use service users and carers in that. And some of those range from improving communication between staff, patients and carers on a dementia ward, improving discharges and discharge plans of people with learning disabilities in the community and reducing the amount of referrals back into the service, developing and testing audit tools for sepsis, reducing the number of pressure ulcer incidents occurring, an acute equipment project using having the appropriate use of equipment in a timely dispatch and collection method. And all of this, you know, absolutely does impact in terms of those comments that we get back through our feedback. So what I wanted to do now is just leave you with a story. And this is a story of Louise and Alfie, and it's from our CAMS service. And I just want you to tip back and just enjoy the next couple of minutes. I'm hoping that it'll work, Anita, and we'll be able to do that. But over to you. I'll let you put the video on.
My name's Louise. My son's name's Alfie. We hunt month back in March because Alfie had begun to show some really difficult behaviours. Alfie has ASD and LD. His routine completely stopped during lockdown and he really didn't cope very well with this. He was showing lots of violence. He would scream for hours on end. He would hit us, throw things at us, try and hurt his brothers. And he was just not accepting them being around at all, injuring himself, always wanting to hurt us. We were unable to take him outside. All the things he loved just stopped and he just became unmanageable. It got to the point where we were thinking, how can we keep Alfie at home for much longer, which was devastating because we absolutely adore Alfie. I'd contacted CAMS. We had seen them before in January to get Alfie some medication there, and then they stepped in and started to help us.
So Mum contacted us after initial assessment. After a couple of months, behaviours escalated. So Mum contacted us. We put an emergency review in straight away to see what was going on. We offered medication then, but alongside that, we offered some positive behaviour support work. So we completed what's called a core support plan, which identifies all of Alfie's needs. It identifies his unmet needs and what may need more work with. And we also completed a functional assessment, which identifies the function of each behaviour. So after that, we worked with Mum and discussed strategies that would work for the family and how to support Alfie to eliminate the reasons for why he was escalating in behaviours. There was some difficulty because behaviours were very, very high in intensity. Family were exhausted. They were doing their absolute best. So we agreed that we would then support by using our outreach service and have our team members going into the home to support Mum, to enhance Alfie's communication skills by doing intensive interaction, as well as being there to support with behavioural strategies.
So Mum was also able to complete lots of ABC charts and behaviour charts, which were very useful, and that was our planning of our work. So the outreach home intervention involved our staff using visual aids, which were focused on Alfie's structure and routine, and being able to cut it down to short little steps for Alfie to follow, which appeared to really help him. We also implemented some behaviour recommendations around his sensory needs and also his responses to behaviours. So, for example, Mum given adapted responses to some of the behaviours which Alfie would respond differently to, such as using different recommendations such as the low stimuli room where Alfie can go to if he's too agitated, and other sensory needs that needed addressing.
We feel like we've got Alfie back. We were at a point where we just didn't know what to do, and that they came in and they almost gave me a way to communicate with him so I could get into his world a little bit. It made me see what was going on with him more, which made me able to cope with him better. They spent a lot of time just watching and talking with me, and the step-by-step has broken down Alfie's anxieties a lot. I mean, he still can be a little monkey. We can still have days where he rages, but the violence is dramatically dropped, and we're not thinking anymore that we need to not have Alfie living at home, and we can get into his world and allow him to be himself without us always putting our others on him, kind of thing. I was kind of expecting him to react a certain way, and he just can't do that, but I couldn't see that myself. He spends a lot of time now with his brothers. We know when he's had enough. We can read those cues now, so then we all step back. Cam's also helped us get a safe space for Alfie, and just being at the end of the phone as well when I've had a bad day and talking through it, and they can probably say, well, this is probably where it's gone a bit wrong. And the ABC charts and the keeping the track of the behaviours made me realise he was showing OCD tendencies, which were completely masked by him just screaming because he was probably so heightened because we weren't understanding his needs. They have been amazing.
I think it's just probably important to add, I think the reason why it has gone so well, is like Louise says, is the communication between the team and the families and just being available. So things can be discussed there and then, and that can break it down as well.
And also persevering, because it doesn't look like it's working at first, and just get it into your daily life. It has to be constant.
Thanks, Anita. So that's the end of my session. I hopefully wanted to just share a story which demonstrated actually the code. It demonstrated what matters, and it actually demonstrates actually the amazing work that our nurses are doing in terms of really making a difference to individuals. So I suppose on behalf of myself, Emily and our team, thank you for adopting us into a nursing directorate where we feel that we very much are part of a wider family, but also just really thank you for letting us to receive and read really positive compliments and feedbacks about the amazing stuff that you do. You don't always get to see it, and we need to get better at sharing it, but I'm certainly on behalf of myself and the team, thank you for everything. And it's been lovely just to share some positive stories on a Friday afternoon after the end of an amazing week. So thank you.
Oh, thank you. Thanks, Alison. Thanks, Emily. And yeah, really powerful. I've had a little cry already, and I'm such a crier, so I do apologise, but it was such a lovely presentation, Alison, like you say, to really think about how it connects, because I think sometimes we don't always think about how we connect to the experience and involvement and the powerful role that we play. You know, I mean, that's everybody, isn't it? But I know we're focusing today on celebrating nurses, and Alfie and Louise's story is just such a lovely story. I think lots of lovely, fabulous comments. And I think, you know, some really key things like those magic moments, like you say, and how we connect those and how we remember those and celebrate those, because I think we've talked a lot, haven't we, about resilience through the week, and I think that's another good thing from a staff well-being, isn't it? That's what keeps us going, and it's reminding and rewarding. So yeah, really lovely to have that positive presentation. Has anybody got any immediate questions for Alison or Emily? See the comments. Lizelle.
I don't have a question, Alison. I've got a couple of comments to make. Firstly, thank you for sharing the Director of Nursing Fellowship projects as the Nursing QI projects. We're really proud of that. I was involved in a focus group as part of one of the projects with patients recently, and it's really just to reiterate what you've said. Some of the really strong themes and information coming out of it, I'm not going to give the detail around it, but some of the information that came from patients that's the stuff that's really important to them is about exactly what you've said about staff introducing themselves, staff knowing their names, and staff knowing what matters to them as patients. And I just thought it was very interesting that you mentioned that, and I just really, because it resonated with me, and I can't tell you how important patients find that and how they've emphasized how important that is. So it is really down to us as nurses and other healthcare professionals to get the basics right, because that's what I feel, you know, knowing your patient's name is the basics for me. So that's the one thing. The other thing I wanted to comment, when you showed the nursing projects and you talked about service user involvement, again, in the projects we are using experts by experience and service users to inform the projects. And again, I can't emphasize the difference and the insights they bring to the projects. So these are just comments that I wanted to make, Alison.
Oh, no, thank you. Thanks, Lizelle. And it's really good to hear that it resonated in terms of the reality. And I suppose the call out and the thing we'd probably like to leave is we are here as a partner, as an enabling team. So, you know, anything that we can do in terms of supporting yourselves, your teams, your colleagues around, you know, understanding your data or getting more access around service user care involvement, we'd be really pleased to work with you and support you. You know, we are there and to do that, and to call on us whenever you feel that we could add some value. So but thank you. It's good to hear that it's being through that, you're living it, and it's feeling very different and very powerful. So thanks, Lizelle. Deanne.
That was really excellent, Alison, and really great presentation and such positivity. And you're absolutely right when you said we focus on the things that are wrong rather than things that are strong a lot of the time, and we've got to start to shift that culture and really celebrate the amazing care that that LPT gives. And, you know, particularly as we think about the nursing profession. I was also just wondering, actually, you know, how can we share that video is just lovely. It made me really emotional as well. And, you know, how can we find more forums to share those stories in? I was also thinking we share quite a lot with the CQC, actually. We share, obviously they get lots of things around incidents and notifications, and but we also send things like our newsletters, and not for an answer now, but to consider, could we consider sharing a video like that, a story about patient case? It's so powerful, and you hear it in patients' words. It was excellent. Thank you so much for sharing it.
Oh no, thank you to the CAMS team for I suppose for creating the narrative. But yeah, we've got lots, as I say, just to say we do have lots of stories. Some of them are really challenging, and they're just as powerful because they are challenging, and they have to be heard, don't they? But you know, we have some really funny ones and some really good ones. And we also support people in terms of how you could collect your own stories, because I think, you know, it's a really good reflective tool, isn't it? Sometimes for the team to hear back, you know, when they've had a hard day or a hard shift or a hard week, that actually, you know, if you can go back and listen to some of the stories and the narrative of what people are actually saying about you, it just puts it into that bigger perspective, really, doesn't it? And, you know, it's not that bad. But yeah, really happy to help you celebrate the good stuff, because we do get a lot of it.
That's lovely. Thank you. Thank you very much. So without further ado, I'll now welcome Claire Armitage and Lizelle Bernhardt, who are going to talk about harnessing the potential of early career nurses, our Director of Nursing and AHP Fellowship. And you've also got Eva and Claire that are going to join you as well. So over to you. Thank you.
Thanks, Emma. Anita, are you loading our slides? Just reloading. Yeah.
You can sing now, Lizelle, while we wait.
No, not a good idea at all.
Don't ask me to sing. I sing like a frog.
Oh dear. Right. Right. Thanks, Emma. Can I just say thank you for allowing us back again. Last year, we were fortunate enough to be able to introduce the Director of Nursing Fellowship. Just to introduce myself, I'm obviously Lizelle Bernhardt, and I'm Clinical Academic Careers Pathway Lead in LPT, and I'm also the Program Lead for the Director of Nursing Fellowship. So what we're going to do today is a little bit of a different format. I'm going to quickly do a brief overview of the Director of Nursing Fellowship. I'm going to introduce our first cohort of fellows, and then I will hand over to Claire and the two Don fellows, Claire and Eva, if that's okay. Next slide, Anita, please. So the Director of Nursing Fellowship Programme is a foundational development opportunity for Band 5 nurses. The programme is based on the Chief Nurse Fellow model that was originally developed by Dr. Jo Cooper and her team in Nottingham University Hospitals. In response to a shortage of registered nursing staff in NUH, the original Chief Nurse Fellow programme was conceptualised and designed to develop foundational clinical and academic skills in frontline staff. This initiative has been adopted across many organisations in the UK, and although the key principles are similar, many of the programmes differ in content and focus. We rebranded our programme as the Director of Nursing Fellowship to reflect Anne's title. And the aim of the programme is to implement a bespoke programme designed to develop skills in leadership, research and innovation, and improvement science for frontline clinical staff. The Don Fellowship is aimed at Band 5 nurses who completed their preceptorship. It's 1 year in duration, of which the fellow will spend 1 day a week on fellowship activities and the rest of their working week in clinical practice. So our first cohort consists of a total of 6 fellows, 2 in each clinical directorate. Next slide, please, Anita. The key components of the programme are taught elements and insight opportunities in leadership, quality improvement, and research and clinical academic skills. In addition, each fellow will undertake a quality improvement project that Alison has already mentioned some of them, that is relevant to their clinical area. Fellows are supported by a clinical and academic mentor with 4 to 6 weekly contact, and several of our deputy heads of nursing stepped up as clinical mentors, while the academic mentors consist of LPT staff across different professions who have doctoral qualifications or are currently undertaking their doctoral studies. Fellows have a quarterly coaching meeting with Anne, the Director of Nursing, and to enhance their learning further, they have 6 weekly action learning sets facilitated by either our heads of nursing or deputy heads of nursing. Their project findings will be disseminated through presentations, publications, and quarterly reports, and we will formally evaluate the programme through structured feedback and through case studies, which we will use to enhance future cohorts. And obviously, we'll have to have a celebration event at the end of or completion of the fellowship. Next slide, please, Anita. So our fellows represents a wide range of clinical services from all three directorates. So in community health services, we have Faith and Claire. You will hear more from Claire a little bit later. Faith works as a staff nurse in Hinkley and Boss with Community Hospital, and her project will evaluate the impact of information technology on frontline nurses' time in a community hospital ward setting. Claire is a complex care nurse in community health services, and her project focuses on improving the uptake and effective utilization of pressure relieving equipment in the community setting through the delivery of staff and carer training. Next slide, please. In DMH, we have Kelly and Dan. Kelly works as a mental health practitioner in the crisis team, and her project focuses on increasing the continuity of care within the crisis care pathway by reviewing current key worker and assessment processes. And Dan is a staff nurse on Wakerley Ward, a male dementia ward, and his project focuses on improving the quality of communication between ward staff, patients, and their families. Next slide, please. And finally, in FYPC LD Directorate, we have Eva and Danny. Eva is a community learning disability nurse, and her project focuses on improving the number of re-referrals in community learning disability services through the review of nursing intervention and discharge processes. And Danny is a staff nurse on Langley Ward, our eating disorders ward, and her project focuses on improving staff knowledge, confidence, and quality of care through review of the current staff induction package. Next slide, please. Our first cohort is now well over half. Is it just me who's hearing the echo?
No, I was just going to say, if we can just make sure we all go on mute, that'd be great. Thank you.
Okay, so let's try again. So first cohort is well over halfway. We're starting to plan recruitment of the second cohort, which we're hoping to start in October this year. So if there's any Band 5 nurses or colleagues on this call who may know of someone who would be interested, we'll be advertising soon. So please look out for us. And then just finally, future plans. We've started to initiate conversation with our AHP leads to develop a Director of Nursing AHP cohort. And that is the Don Fellowship in a nutshell. So Anita, if you want to move it on to the next slide, just for a moment. So I'm going to hand over to Claire Armitage, who is going to have a conversation with two of our Don Fellows, Claire Clark Green and Eva Quateng. Over to you, Claire.
Thank you, Lizelle. Anita, I'm just wondering whether it might be worth unsharing for a few minutes so that we can all see each other than the size of postage stamps. It's always nice to see faces, isn't it? Thank you. Hi, everybody. Lizelle has already introduced our Don Fellows who are here with us today, Claire and Eva, who I think you now should be able to see on your screen. And I'm just going to spend a few minutes talking to Claire and Eva about what really led them to apply to be Don Fellows and how it's going for them, and just to catch up really on their experience and how it's been so far. So welcome, Claire and Eva. Thanks for joining us. And I'd like to start with a question for you, Claire, first, if that's okay. Can you tell us all what inspired you to become a Don Fellow?
Hi all, hi. So when I saw the advert, it kind of fit me, absolutely fit me. I'm kind of one of those nurses where I need to find things for myself. I won't just take that is the, this is what we've got to do, and I need to find other evidence for myself. So I'm quite ambitious, and I like to do new things. So the quality improvement for me was a fantastic element to it. It allowed me to look at change, implement it, and then make changes into practice, which was just fabulous for me. I like to challenge myself, so it was a good way of fulfilling that for me, for my personal growth as well, and developing my skills, especially having the two mentors, and having Anne obviously as a mentor as well. So it just fit me totally, and I've absolutely loved it. It's just brought out of a passion for me that I knew was there, but I didn't know what it was until I started doing this kind of work, and now I'm just in my absolute element. I like the trialing the evidence-based practice, and then getting feedback from the patients, and then the leadership as well. So that's really come into play where it's really helped me, especially going into the complex care nurse. So I've really enjoyed it so far. I'm looking forward to the next steps.
That's really great to hear. Thanks, Claire. And what about you, Eva? What attracted you to apply for the opportunity?
Hi, everyone. Yes, so for me, when the program was advertised, I had only qualified as a nurse for just about over a year. So when I saw the advertisement of the Dawn Fellowship program, I thought it was going to be a very good opportunity for me as a newly qualified nurse without much experience. So yeah, I took the opportunity to apply for the program, especially considering the fact that I was going to have more knowledge and skills in quality improvement. And that is the area that I'm really interested in. And also, when I was a student, the research module was my favorite module. So I thought, wow, that would be a great opportunity for me as a newly qualified nurse to go into that and learn more about quality improvement projects, research, and also develop myself as a newly qualified nurse for my professional development. So yes, since I've joined the program, I've really enjoyed it. I've learned a lot, and in terms of the leadership presentations, the action learning sets, and the KY program, the KY project itself, it's been a very good experience so far, and I'm really enjoying it. Yeah.
Thanks, Eva. So you're in the thick of your QI project at the moment, aren't you? Can you tell us a little bit about it?
Yes, so for me, my topic, I looked at minimizing or improving the number of referrals coming to community CNLD team. As I said, I qualified in 2020, April 2020, and since I qualified, I realized that most of the times we get referrals, or when referrals are in, the nurses will be like, oh, this person has come back to us. Oh, that person has come back to us. So they were asking, why have they come back to us? Did we do everything right? So from that angle, when this opportunity came and I was looking for a topic, it's like, oh, this would be a very good opportunity to look at why our service users are coming back to us 6 months or a year after they have been discharged. Is there something that we did not really, I wouldn't say do right, but did we do everything that we were supposed to do? What should we have done better? So all of those questions. So that is what I'm looking at now. That's what my project is about. So at the start of my project, I collected some information from Reshma. In terms of data, the number of referrals that we've had since 2019 to 2021. And what I realized is that since 2019, 2020, there were little referrals coming in. For example, with the city team, we only had 2 people coming back to the city community team. But in 2020, 2019, there was we had 19 referrals. That was about 15%. And comparing it to the other teams, the Hinckley and Bosworth team, the city team, South and East team, the Charnwood, all of them had an increase about 18% or 27%. So getting that information made me realize that, oh, this is something that I really need to do a quality improvement project on to see how best we can improve our service. And also for us with the city team,
how to minimize our waiting list, because we've always had a long waiting list whereby initially people will wait for 24 weeks before they are allocated to nurses to be seen. But later that waiting list was increasing to about 30, 36 weeks or 37 weeks. And the service users were not really, happy with that. So I look at it as a good opportunity to embark on that project to see what we can do best in order to minimize that waiting list, so that we will have more capacity as nurses to attend to other people on the waiting list. So far with my project, I've managed to complete a survey. I developed a questionnaire, an accessible easy read questionnaire for my service users to collect information about the intervention that we provided to them, why they have come back to us, whether their needs were met when they were with us, and also whether they were involved in their discharge planning before they were discharged. And if they were involved, did they understand everything that was discussed in their discharge planning project? And I mean, the responses was great. The responses that I got were great. So in all, I managed to get about 5 service users who were involved in the project, and we had a very good feedback. 4 of them said they were involved in their discharge planning. Just 1 person said that he was not involved. Even at that, it was due to the level of his LD, and things need to be explored further in that area. So having that, I've had a discussion with my team, with my QA advisor, in terms of the measures that I need to put in place to make sure that that aspect of our discharge planning or discharge processes, in terms of involving our service users in their discharge planning, can be improved by at least 10%. So that is where I am now with my project.
That's brilliant, Eva. Thank you. It's such an important project given the pressures that we're all working on these days. So thank you for sharing that. I'm going to come back to Claire now. I wonder if you could just give us a quick summary, Claire, of what you feel has been the learning so far from the fellowship, from your perspective.
Okay, so I've learnt lots really. So how to implement change, how to find it as well, what to look out for. I've learnt how to change my idea into a quality improvement as well, and look at the focus around it. So I've been part of the wider pressure water prevention team as well. So I've learnt lots in the of what's needed. So how much we are doing behind the scenes that I wasn't even aware of. And how much work we put into pressure care as well. So the quality improvement part, I've learnt all about Life QI and how to do a plan, do, study, act, which I've actually implemented in my daily work. So I'm using that now as part of my decision making, which is giving me some structure as well. The research element, so we've gone through quite a lot of research element and how to look for reliable information. I think one of the really good things that's part of the project was the external speakers as well. So we've had some really, really good external speakers that have given some really inspirational talks about their journeys. And it made me think that actually it is achievable. So whatever your goals are, you can achieve it. So it's given me the confidence really to be able to set new goals and to go and achieve them. And also when we did part of the beginning of our course, we did the Myers-Briggs self-assessment tool, and that has taught me loads about how I learn, how I can talk to others, and how best I can work with other people. And being part of a new part of the leadership team as well, I'm really for personal growth, I think that's really important, how you develop and talk to people to get the best out of them. So there's lots of different parts of the course that I've really enjoyed, and I'm still learning. We've still got 6 months to go. So yeah, it's been fantastic so far.
Thanks, Claire. That's not bad for 6 months of learning, is it? I've certainly packed loads in. I wanted to ask you both just for some quick headlines of what have been the challenges, because this all sounds really positive, but I'm aware it's not been as easy as it might seem. And I just wonder if you could both just give me a couple of the main challenges that you've encountered. Maybe I could come to you, Eva, first.
Yes, so for me, the main challenge that I've kind of encountered during this program is when I started with my QI project, and when I was trying to recruit people into involving in the project. Obviously, I'm a learning disability nurse, and considering my patient group, the level of their learning disability, so that's the challenge, their communication abilities, mental health issues, so many things. So getting them to involve. Obviously, I did a simple, easy read information about the project and consent for participation, which I have to make sure it was, of course, accessible in terms of easy reading. And also some of them, because of the level of their learning disability and communication difficulties, I have to speak to their carers to support their involvement, which sometimes the managers or the carers will say, oh yes, we will help you, we will do that. But at the end of the day, they never did, and I have to be chasing people. And initially I thought of using a focus group or the patient talking group, but because of COVID-2, we couldn't have that. So those were the little challenges that I've encountered so far. But at the end of the day, I was able to, overcome those challenges, and it's all part of the learning. It's made me realize that, oh yeah, these are my patient group that I'm working with. They've got communication issues, they've got this issue, but in terms of involving them in such projects for their benefit and for the benefit of the service, the challenges are there, but I've learned more about how to go about the challenges in order to get them involved, how possible I can. So that's the little challenge that I encountered.
Right, thanks, Eva. What about you, Claire? Has it been similar for you, or is there anything different that's been your main challenge?
Yeah, similar really. I think some of it is time management and learning how to manage the time. I've had to be adaptable, so change my working days to be appropriate for the team as well. So on some of my days, I've probably done some face-to-face clinical work and then come into, but got that back at the times as well, especially if you managing Teams meetings and stuff where you've had to be adaptable and perhaps done it on clinical days. But I'm quite lucky because I've got a very understanding manager and a very good leadership team that's allowed me to do that. MS Teams, it works when it works, but when it's down, or when, if you're not very good with it, or you're in a bad area, it can be a problem. And working with exhausting staff, finding and trying to flip it so that we all see a positive in what's going to help us, especially for the projects, getting their ideas. I've found Tea and Biscuits really help the team. The action learning sets as well that we've been part of. If you have got a challenge, we've brought it to the actual learning sets, and then between us we've worked it out. So it feels like you're supported. So that's good.
Yeah, that's great, Claire, thank you. And I wanted to ask you as well, have you got thoughts about your future goals, your future career goals leading on from the fellowship? Because you're halfway through it now. I wondered whether you got thoughts about what's the next steps, or is there a 5-year plan?
Yes, there is. There wasn't one. When I first spoke to Anne and we did a one-to-one, there wasn't really a goal, but she was quite good in giving me some links, and I spoke to quite a lot of people and have developed my networks really well. It's taken some time, but yeah, I have. So I've spoken to one of my managers and we've had a discussion about bumping onto some more quality improvements and working that alongside my clinical, because we've got really good ideas and we've got some really good like-minded nurses that are have got some fantastic thoughts about quality improvements. So my short-term goal now is to develop my clinical skills as well. So I'm going to go on to the consultation skills, and then there's B300. And then in terms of my academic, I'm going to go down the academic pathway. And I've started on my CV, trying to find some mentors as well. And I've just applied for some funding so that I can start making my CV look better, with the view, with my mentor's help, to go on to apply for the PCAF through the NIHR, and then hopefully in time go on to do my PhD.
That's fantastic, Claire. Yeah, for somebody who says you didn't have a plan 6 months ago, that's incredibly impressive. Thank you. I'm hoping, Emma, I've got about a minute left for one quick question to Eva. Is that?
Yes, I think I can see.
Sure.
Ryan and Kelly have joined. I think we've had questions as we've gone along, haven't we, with them? So yeah, that's fine. Thank you.
Thank you. So I'll quickly give the last word to Eva, because I know, Eva, you've got some thoughts about how you might like to support the next cohort of fellows.
Yes, I mean, we've had such a great, opportunity to be part of this Dawn Fellows. So I think it would be a good, an honor for me to also support the future cohorts who are coming in terms of peer mentoring, trying to create some network groups to support them, also encouraging other peers and colleagues to think about applying for the fellowship as well, the fellowship program. So still talking to some of my colleagues about that. And also in terms of take opportunity to highlight the benefits with my managers as well.
That's fantastic. Thank you, Eva. Thank you, Eva and Claire, for being with us today and sharing your experience. And thank you also, Lizelle, for your leadership. And I'm sure you've enjoyed hearing the impact it's had on just 2 of the fellows.
Can I just say, I'm bursting with pride. Not that I'm biased in any way, but I'm just so proud of all of them.
No, it's been brilliant. Thank you.
Oh,
thanks, Emma. We'll hand back to you.
Oh, well, thank you very much. Yeah, thank you to you all. I think that there is a question in from Alison, actually. So great to hear how you're both involving patients in your improvement projects, and interesting to hear if this feels different to how you're working with patients in your clinical roles.
It was just interesting with Eva talking, Emma, about, how when you're involved in service users, particularly with learning disabilities, it's a different conversation, isn't it, when you're looking at it from an improvement perspective to what you'd be doing on a clinical interaction. So I'm just really interested, because actually there's some nuggets about it, how it makes people feel different. We'd really like to use that and share that with other people as a reason why we should be doing this, and not to think about all the reasons why we shouldn't be doing it. So that was really the reason for the question.
Yeah, thanks, Alison. Okay, I'm conscious of time, so I'd like to welcome both Ryan Ball and Kelly Butler, but I think Kelly can't hear us still. Anita, I don't know if there's anything you can do offline to connect. Can you hear us, Ryan?
Yes, I can hear you.
You can hear. And Anita, thank you, is going to call Kelly just to see if we can call her in. So thank you very much. We really, over the next 10 minutes, wanted to just celebrate the role of nursing associates. So for those of you that don't know, nursing associates first joined the nursing workforce and the NMC, the Nursing Midwifery Council, in January 2019. We currently have 17 registered nursing associates, and the roles are registered on the NMC register, so it is a registered role with standards of proficiency. The role was first described as a hybrid role between a healthcare support worker and a registered nurse. The nursing associates are subject to following the same code, the NMC code that Alison spoke about earlier in her presentation, and also revalidation. We all have to revalidate as nursing professionals. So I'm really pleased. What we were going to do, similar, Claire, to the conversation we've just had with Eva and Claire. We've got two Claires, haven't we? I've got some set questions that I was going to ask Ryan and Kelly. Ryan's registered and Kelly is doing her training at the moment. So whilst we're trying to call and connect with Kelly, Ryan, shall I come to you and ask you the questions? Is that okay?
Yeah, that's fine. Yeah, no problem.
Okay. So do you just want to start by telling the group your name and where you work?
Hello, everyone. Good afternoon. My name's Ryan. My name is Ryan Ball. I'm a nursing associate and employed by Leicestershire Partnership Trust. I currently work at an inpatient unit at the Everton Centre Community Hospitals, and I work on Clarendon Ward, which is a rehabilitation ward for elderly patients.
That's lovely. Thanks, Ryan. So why did you apply to do your nursing associate training? What attracted you to it?
Overall, because I'm passionate about delivering a high standard of quality of care, to be honest with you, and ever since I joined the trust about 8 years ago, I've always been itching to learn more and to improve myself and the care that I provide to my rest of my patients. And you know, it's set a benchmark in order to improve the service as well, and ensure that the rest of the nursing team is supported as well.
Bless you. Thank you. And what do you most enjoy about being a registered nursing associate?
I enjoy that every day is different. You know, you can have days where you can come in and your staffing's a bit under budget, but then you focus on the better things that you need to work on a day. But then you have good days where kind of everything goes to plan and you're able to deliver and execute the care that you want. And yeah, it's just, I'm able to work autonomously as well in order to carry out the care as well. That was a big positive for me personally, and I'm able to kind of reflect on things on myself, whether it's my personal performance or whether I could do something differently to what happens the last time. It's numerous reasons, to be honest with you. Yeah,
no, that's great. And I mean, it was a new role, and so have there been any challenges along the way, or anything, any hurdles, or
for me personally, or just
could be personally, or just feedback from the group, thinking about when it was introduced?
When I first started the course, there wasn't that many from LPT because I was in a big cohort that was from UHL.
Yeah.
So, and a lot of the people from LPT were based in community, so a lot of them were in children's and schools and what have you. So I was only myself from a ward-based environment. So, and I was one of the oldest ones on my course. So it's kind of a bit strange when I'm this. I won't say elderly, but the oldest one there on the course, and the rest of them are quite young, ranging from like 18 to 24. So you know what I mean. Gives you that kind of fresh perspective of what's important at that moment in time, definitely.
Yeah, that's interesting. And what advice would you give to anybody who is interested in becoming a nursing associate?
Be prepared for what you have to undertake, because it is a very tough role. It can be very demanding, as everyone's quite familiar. There's a lot of demand on nursing at the minute, and in order to get everything right and correct. And just, it takes a lot of grit as well. It takes a lot of grit, but I think that's what I enjoy about it. And if you're looking to improve clinical skills as well, to go that extra step further as well, and it's worth it. It's massively worth it.
Brilliant. And I've got two more things. How do you see your future? You know, what are you thinking about in the future?
So at the moment, I'm just currently through an application to join Open University to finish off my nursing degree.
Oh, fantastic.
So yeah, the future looks bright.
Yeah, that's brilliant news, because I think that's a really important part, isn't it? I didn't say at the beginning that this can be a bridge, can't it, to doing your nurse training, and not for everybody, because we do need nursing associates as well, but that's fantastic news. I'm really pleased for you.
I think in some way I've kind of started preparing myself for that role, because I've taken on roles in regarding quality improvement as well. So I'm current champion for medications management on my ward. So in order to get that understanding of what research goes into improving the service as well, that will certainly come up regarding the next stage of the nursing program that I go on as well. So it's great to have that responsibility as well.
Yeah, that's fantastic. And finally, what do you love most about being a nurse?
Seeing patients smile, knowing that you've kind of made a little bit of difference to their life, whether it's be minor, major, just giving them that little bit of support that they need to kind of get through the day, because every day can be tough in the mind of a patient. I've been there myself personally on that level, so I know how tough it can be. So it's just ensuring they get that reassurance to kind of get them through to that next step, to ensure that they're discharged home and back with their loved ones. That's what it's all about, isn't it?
That's beautifully said. Thank you so much, Ryan, and thank you, because I know you're working today, so you've taken time out. If you're okay to hang on for a minute, I'll just pause and see if anybody's got any questions for you.
Sure, that's fine.
Thank you. Emily.
Hi Ryan, really good to hear your achievements and your future plans. I wondered if you've inspired anyone you work with to follow a similar route.
Yes, actually, there is a year after I started, one of the healthcare assistants on the wards started her nursing associate training, and she's just waiting for her PIN to come through in July. So we'll have 2 nursing associates on the ward, and I believe there's talk of another one of our healthcare assistants applying for it when the next wave comes out as well. So it's nice to be that kind of role model and influence to kind of give that person that inspiration to go and push on to become what they're best at.
Yeah, that's brilliant. Thank you. I think there's some lovely comments as well, and I think there's a real theme, isn't there, from the fellows, from yourself, Ryan, and I'm hoping Kelly can hear us now, and we'll get the opportunity to hear from Kelly around that ambition, that drive, that wanting to make a difference for patients, quality improvement. I'd love to clock up how many times that word's been said through today's webinar, and also about experience. Oh, poor Kelly's got no sound. So I'll come to Anne and then Azelle.
Thank you, Ryan. Wonderful to hear your passion. I suppose my question, and we haven't met, so I'm Anne Scott. I'm the Director of Nursing. It'd be nice to come and spend some time with you, Ryan, if that's okay.
Yes.
Just announce it in front of everybody for you. I've just had a fantastic morning, actually been out and about on some of the MSOT wards and the Bradgate unit. I can hear your passion, and that's really great to hear for me. How do you maintain your passion? How do you maintain your resilience? Because it's really, really tricky, difficult, it's challenging. I've heard some really quite difficult stories this morning about the challenges, particularly around staffing. So I can hear it in your voice, and I heard it in Claire and Eva's voice, and no doubt I'd hear it in Kelly if she could hear us. But there's something about how do you maintain that, that sort of joy that's coming through that I can hear.
I suppose it's I don't really suppose I have an answer for that. I mean, because I kind of just I come into work with a fresh mindset. You know, I think about my mental health as well and how it can impact me outside of work. Because I have good days on the ward. I had bad days. You know, you try not to take your work home with you, but sometimes it stays in your mind as well if you've had such a bad day at work and what have you. But you know, Me personally, I'll cycle into work, so I'm nice and fresh in the morning, and I'm ready to start the day, whether it's a good day or a bad day. It's the sole focus is ensuring that the patients are safe and they've got the care that they need as well. That's the priority at the end of the day.
Thank you, Ryan.
And I think it's about managing your workload as well. It's about prioritising what needs to be done straight away, how can we act on it, and how can we improve things as well.
Okay, Ryan. So now you are in my radar. You know that, don't you, my dear? And so that means that I might be picking on you to come and do perhaps to do a bit of probably a presentation to perhaps some of our ward sisters as well, and some of our matrons, because the joy that I can hear in your voice and the passion and the so what, the point of the aesthetics, the arts of nursing, I think is almost bottled in the 5 minutes that I've been listening to you. So thank you very much, Ryan, and thank you for working for LPT.
Thank you.
Thanks. That's a good thing, Ryan. That's a good thing to be on Anne's radar. And we absolutely need champions, because we need to champion this role. Absolutely, because it's so valuable. Lizelle.
Yeah, I just have a sort of a comment question broadly for Anne and Ryan. I'm just looking for opportunities. I'm always looking for opportunities, but I'm just wondering, Anne and Ryan, do you think there's do we have a bit of a gap for something like the Don Fellowship for the nursing associates? I'm just sort of conscious that we're thinking about the nursing placement for research, and then we go on to our band 5 nurses and the leadership band 6, 7. But what do we have for our nursing associates? Can we create something? Is there room? Is there interest? Just wondering, thoughts.
Can I respond, Emma?
Yeah.
Shall I jump in? Is that all right, Ryan? If I jump in first, and then I'll be quiet.
Yeah, sure.
I think the simple answer is yes, absolutely. Yeah, and there is. I think what I would like to see as well is a bit of a bridging for nurse associates who would like to go on to do their their registered general or their registered mental health nursing. I think there's something around that I'd like to look at, Lizelle. But absolutely, as a nurse associate, what more can we do to offer for a development opportunity into perhaps more senior nurse associate roles? And I think there's we need to start thinking what that looks like. So that would be my answer, Lizelle. And I think you've just given yourself another to do. Yeah, if that's okay, if you could work that one through, we can have a conversation. And Claire, I know you're retiring soon, bless you, but you are coming back to help with this. So I'm looking at you two to devise and design something and land it with me, and let's have a look what that looks like.
Yeah, sorry.
That's a great idea. Thank you. Sorry, Lizelle.
Sorry, yeah, talking, not using a hand. So I think what we'll probably do, Anne, is check in with you what your vision is, and then we will get in touch with Ryan and perhaps some of the nursing associates just to inform what they think would be useful.
That's a great idea.
Great idea. Thank you. Right, I'm conscious of time. I just want to check, Kelly. Can you hear us?
Hi, I can now. I'm so sorry.
Brilliant. Okay, so Kelly, oh, that's so good that you can hear us. Shall we just ask you is everyone okay just to hang on for a minute, and then we'll just ask Kelly the same questions. So Kelly, well, we know your name's Kelly, so
Yeah.
And you're working as a trek. Do you want to tell us where you're currently working? I know you're a trainee.
Yeah, so my base is the integrated community palliative care team based at New Parks Health Centre, and I've been with them for about 4 years now. I started as a Marie Curie HCA and then joined the NHS, and now I'm doing my my nurse associate training.
Lovely. And similar, same question. So why did you apply to do your nursing associate training?
I've always wanted to be a nurse, always, but I had my family quite young, so I've had to work, and I need to work full time to support my children. So for me, going to university wasn't an option. And then when this came about, I then had to join the NHS, obviously, to be able to do it, which I did. But it was just an opportunity for me to be able to work full time and stay in the team that I absolutely adore and become a trained nurse as well.
Yeah.
So yeah.
Fantastic. And what are you most enjoying about your training as a nursing associate?
I think the opportunity to do my placement. So for me, I've always worked in palliative, so to have the opportunity to go onto the wards, and I've always worked in the community.
Yeah.
So, and the placements that I've had have been amazing. And also the group of girls that I'm with, you know, the reason I'm late is because we finished our first year today. It was our last day of our first year, so we've been at uni, we have a presentation. But yeah, they're all such an amazing group of people from varied backgrounds, and the sort of the knowledge that we each bring, and it's just, yeah, it's hard. It's been hard, but it's just been so enjoyable meeting different areas and different teams and the passion that the nurses have on the wards as well.
Yeah,
it kind of inspires you to want to be better.
Brilliant. And have there been any challenges along the way?
I think we've all found it quite intense, so working full-time and being a student, and obviously being older and having a family, the amount of things that have happened to us all in the last year, we could write a book on, and then to be able to continue to study. So I just think that's the most challenging thing, because we're all in the NHS anyway, so we kind of, the placements and things, it's easier to deal with because we're used to working. But yeah, I just think it's a lot of work, and the 4 areas of the different sort of so the children's, the adults, the mental health, and the learning disabilities, it's a lot to cram in to 2 years. But yeah, we've managed the first year, so.
Oh, well, congratulations. That's a real milestone, isn't it, in your training?
Yeah, I'm very happy.
Oh. So what advice would you give to anybody that's interested?
I think just to have that knowledge that it is harder than what we think it is.
Yeah.
But just to go for it and enjoy it, really. I think that, like I say, the girls that I'm on my cohort with are all so passionate about the areas that they work in. And I think that if we can have that passion and the train, I mean, we all want to do our band 5 as well. We had that conversation today. So we've all said that we want to do the top up. We want to be band 5s. We want to be registered nurses. So to have that passion in a group of people to take forward, and you know, we're also proud of the fact that I love working for LPT and the NHS, so I'm dead proud of that fact. So to have that kind of mentality initially, I think is key to having the success and the kind of passion in the nursing that you want. So yeah, my advice would be just to go for it, and
being aware of the commitment, but really going for it as well. And the benefits.
Just enjoying it. I think it is a lot of work, but we kind of get wrapped up in that academic side. But enjoy the placements and the different experiences and all the people that you'll meet along the way. And everyone's so helpful as well. Everyone wants to help you and support you, and so I think that's the good side of it.
And final question, and this is the final question of our Celebrating Nursing and International Nurses. What do you love most about being a nurse?
Oh, I mean, with palliative, I love the fact that we can go into a patient's home and maybe change their mindset on, they might have had a really bad experience in the hospital or previously, and to be able to change their mindset on what the NHS is, and to be able to sort of facilitate that care and the compassion and everything that is sort of wrapped up in end of life, to me is everything. It's just, yeah, I just think I'm such a privilege to be able to wear the badge and kind of have that responsibility. It's a lot. It means everything, to be fair.
Oh, that's wonderful. I'm going to be crying again, everybody. So you know what I'm like, I'm a weepy bucket for Kelly and Ryan. I was crying earlier at a patient video and a carer story. So, well, listen, thank you very much. And thank you, everybody, for, I'm so glad we got to speak to you, Kelly. And Yeah, so there's a comment, I don't know if you can see. Thank you, Kelly. I can hear the passion coming through. Thank you for working in LPT. And I'd just like to close the session, but in closing, just say thank you very much today to all of our speakers, and also special thanks to Anita, who's done all of the background and hard work and preparation for the whole week, and people like Lou Evans, Jackie Newton, all of our facilitators across the week, but mostly, oh well, I will cry, I'm just so proud to be a nurse, and it's been fantastic listening to all your stories across the week. So what a wonderful way to end the week. Keep well, keep safe, and yeah, I look forward to seeing you all soon. All right, take care everyone. Thank you. Bye.
Thank you.
Bye.